Hello friends, I am Dr. Arpana. I am a practicing homeopathic consultant. In this channel, I talk to you about the role and scope of homeopathy, how homeopathy can help us in the various medical conditions, how homeopathic medicines can be beneficial in so many health conditions that we discuss in this channel. So today we will be discussing about one condition which is known as AVN or avascular necrosis. So why I have chosen the topic of AVN today, you will get to know soon in the video. Also, if you want to get information about homeopathy and that too in English, then do subscribe to the channel and do not forget to hit on the bell icon so that you never miss any information on homeopathy that I share with you all. So let's get started. Today we will be discussing about the AVN, that is avascular necrosis, and the importance of this topic in today's discussion. So let's get started. So now what do we mean by AVN? So AVN is also known as the avascular necrosis of the bone. It is also known as ischemic bone disease. It can be said as aseptic bone necrosis, osteonecrosis. So these are the various names to the same condition, which is AVN. Now what is happening in AVN? So the blood circulation is not reaching to the bones, and as a result of it, there will be necrosis or death of the bone tissues, and that will result in AVN. So we know that blood is very important for the proper functioning of the various organs of our body. So the blood supply is very crucial for the effective functioning of the cells or the tissues of our body. Now, if the blood circulation is impaired or the blood circulation is compromised due to any reason, what will happen? That particular part of the body will not receive the blood supply, and gradually there will be death of the cells or the tissues of that particular part, and that is why we call it as avascular, which means there is no vasculation, there is no blood supply. So avascular necrosis, because of the lack of blood supply or because of the absence of the blood supply, there is necrosis or there is death which is taking place. Now when it is happening in the bone, we call it as AVN of the bone or avascular necrosis of the bone or osteonecrosis, or even ischemic bone disease, not ischemic heart disease, it is ischemic bone disease. So now, what is the relevance of the topic AVN in today's discussion? Now we are getting to see some cases of AVN which is happening in the post-COVID symptoms, or in those patients who have recovered from COVID and they are presenting with the symptoms of AVN. Now AVN is not a new disease, or AVN is not something that we are seeing for the first time in relation to the post-COVID, but AVN is something which was present earlier also. But we can see the correlation of AVN with the post-COVID patients also. Why so? Now I will be telling you the causes of AVN, and then you will get the answer that why the AVN is related with the post-COVID patients. So now, what are the causes of AVN? So if there is some kind of trauma, that is the first reason of AVN. Smoking could be one of the reasons. If the patient is suffering from some autoimmune condition like rheumatoid arthritis, that can also lead to AVN in the later stages. The use of steroids can also result in AVN. So if there is excessive usage of steroid, then that can also be a predisposing reason or a predisposing factor of AVN or avascular necrosis. So here is your answer. Why are we getting the cases of AVN in the post-COVID patients? So now, what are the symptoms of AVN, or which part of the body is affected by the AVN? So the most common location of AVN is the hip joint. The hip bone is affected. The longest bone, that is femur of our body, so, or the thigh bone, that is affected. and then even the knee joint or the ankle joint, they can also be affected, but the most common affection is the hip joint. What will be the symptoms? There will be pain, there will be tenderness, difficulty in motion. Whenever the patient is walking and he is trying to put pressure on the affected side, there will be some kind of discomfort, then pain, and gradually the pain is increasing to a point that there is restriction of movement. It can also lead to limping in the later stages if there is no intervention taken. So avian can be graded as grade 1 to grade 4, and the severity of the symptoms and the part of the bone which is affected and how much it is affected, if there is some kind of pathological fracture that has taken place, so they will make the prognosis bad, or they will make it more difficult to treat. So it is very, very important to diagnose the condition at the first place correctly and start the treatment. So now coming to the homeopathic medicines which can help in avian. So the first medicine is acid hydrofluoricum. It is also known as fluoric acid. Now in fluoric acid we see that there is a lot of destruction, so bony destruction, long bones of the body, they are affected, there is necrosis, and in avian also we see that there is necrosis. So fluoric acid or acid hydrofluoricum can be a very good medicine. We see there is nightly aggravation of the complaint. The complaint is aggravated, or the symptoms will get aggravated from warmth, and it is better from cold air. So this is a very, very important modality of fluoric acid. The second medicine will be Syphylinum. Syphylinum, again we see it's a medicine which is used when there is a lot of pathological changes or destruction in the body. In Syphylinum we can also see that the patient is having some sort of muscle knots in the body. So muscle knots, avian, then we can think of Syphylinum. The next medicine for avian will be Symphytum. Now Symphytum is a very, very good medicine which we give after bony injuries. So if the avian is a result of some kind of injury which was not treated properly, then again we can think of the medicine Symphytum. There will be pricking pain in case of Symphytum. The next medicine which can help in avian is Silicea. So in case of Silicea, we see there is a lot of weakness, especially weakness of the lower limbs. There will be cramping feeling. So cramps in the feet, difficulty in walking, the leg feel very, very weak. Whenever the patient is trying to walk, sometimes the patient has to actually drag the feet. So dragging the legs or dragging the feet, that could be a very important symptom of Silicea. The next medicine is Natrum Sulph. So in Natrum Sulph we see there is aggravation of the complaint from damp weather, and there is also enlargement of the lymph nodes of the body. There can also be a history of asthma present. So friends, these are some of the medicines which can help in case of avian, and the treatment of avian will largely depend upon the stage of the disease, and accordingly the interventions need to be taken. So that is all about avian and the importance of avian today, why I have discussed this topic. So I have replied this answer to you all. I hope you have liked the video. Do not forget to like, share, subscribe and comment. Friends, if you wish to book an appointment with me, you need to go to my website. My website is drarpana.com. It is drarpana.com. You just need to type drarpana.com and my website will open in front of you, and you can very easily book your appointment from my website. You can also send a message to my office number through WhatsApp only. The number is given to you, and there also you will be provided with the details for booking an appointment. Rest, more details are given to you in the description box. You can go through it. So that is all about avian and the role and scope of homeopathy and the importance of avian in today's discussion. So thank you so much for watching. Let's learn and use homeopathy with me, Dr. Arpana. Thank you.